my name's Elizabeth Ciordia, and then I have a little note card here with some notes. Anatomy differs from physiology because anatomy is the study of the structures of the body, and physiology is the study of the physical functions of the body. Anatomical positions are important because it's a way that they can standardize the way we describe or look at the human body. It allows for better communication and just overall better understanding when two or more people are discussing the body. For example, if it's a patient and two healthcare professionals are discussing a certain region, it's important to have that precise area named, specifically with its own name. That way no confusion or mistakes can happen. The anatomical position is an upright position where you're standing with your feet and shoulder parallel with your toes, and the upper limbs are out with your palms facing forward. Anatomical directional terms. So I'm going to use my doll here. So this would be like superior because it's higher. It's the position above or higher than another. So I would say like maybe like here in the head area can be an example. And then anterior or ventral would be like the front of the body, which is this here as an example. Or if you're looking at the body from the side, this would be the anterior or ventral. Posterior would be the back of the body. And if you're looking at it from the side, this would be the posterior or dorsal. And then we have the inferior, which is like a lower. So we said superior earlier would be the top, so inferior would be like lower, closer to like the tail or bottom. It's a lower position than another. And then lateral would be like the side of the body. So lateral could be like here to the side, maybe here in this region. And then medial would be the middle of the body, which I would say like right here. Proximal is the limb position closer to the area of attachment, which I would say it would be maybe like the thigh area here where it attaches. That would be proximal. And then distal would be the limb further from the point of attachment. So we could say maybe like the foot, like this would be the area of attachment of the leg, and then the foot would be distal. Superficial is closer to the surface of the body, which I would probably say like maybe this, like the skin. And then the deep position would be farther from the surface of the body, which would be deeper inside. Oh, and then I also wanted to go over the anatomical regions. So this would be like the epigastric region, the umbilical region, the hypogastric region, and then here we have the right hypochondriac region, the right lumbar region, and then the right iliac region. And then on this side would be the left hypochondriac region, left lumbar region, and left iliac region. And then there was also a diagram that we learned where It was just cut into 4 quadrants, which they use a lot in the healthcare setting because I see it used often. It would be like slicing 4 regions. So this would be the right upper region, right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. This knowledge is important in the clinical setting and just clinical practice because it's a way that like healthcare professionals can be more precise in what they're describing, and it's a, like I mentioned earlier, it's a standardized way to look at how the body is looked at and described. It helps for better communication, better understanding, and it allows for colleagues to be describing certain areas without any errors. And it just gives an overall better understanding.